Hello everybody, today's story is on opioids, yeah? So, a brief background on opioids. What is an opioid? Opioids are substances that act on opioid receptors to produce morphine-like effects. Medically, they are primarily used for pain relief, including anesthesia, from wikipedia.com. So, what kind of drugs are opioids? Let's find out. Examples of opioids are painkillers such as morphine, methadone, buprenorphine, hydrocodone, and oxycodone. Heroin is also an opioid and is illegal. Opioid drugs sold under brand names include Oxycontin, Percocet, Paladon, taken off the market, Vicodin, Parcodan, Tylox, and Demerol, among others. Alright. And what is the most commonly used opioid? Codeine, fentanyl, hydrocodone, acetaminophen, hydromorphone, meperidine, methadone. Okay, so that's a brief history on opioids. So back to today's story. So, study: damage from opioid crisis tops $1 trillion. Welcome to Billionaire Times today. That's from DaytonDailyNews.com. So let's read the story and find out. The country's opioid crisis is estimated to have taken an economic toll of more than $1 trillion since 2001 and may go to half again by 2020, according to analysis released by a non-profit health researcher. Annual cost of the crisis in constant 2016 dollars increased from $29.1 billion in 2001 to an estimated $115 billion in 2017. The growth rate between 2001 and 2016 was double the rate of the previous 5 years and is projected to increase again in 2017, according to the study by Alterum, a non-profit health research and consulting firm in Michigan. If action to curb the crisis is not taken and current use and mortality rates persist, the study predicts the cost of opioid misuse, substance use disorders, and premature mortality to exceed $500 billion over the next 3 years. Opioid abuse and overdose deaths cost Ohio up to $8.8 billion in 2015, according to another report last year from the C. William Swank program in rural-urban policy at Ohio State University. The Alterum study authors say the opioid crisis is hitting individuals and companies alike in the form of lost wages and lost productivity. The epidemic has also resulted in lost tax revenue for federal, state, and local governments, while forcing up spending on healthcare, social services, education, and criminal justice. The greatest cost comes from lost earnings and productivity from overdose deaths, estimated at $800,000 per person based on an average age of 41 among overdose victims. The number of opioid overdose deaths is estimated to have exceeded 62,000 in 2017, based on data through June, according to the study. Emergency room visits to treat and stabilize overdose patients after an overdose and other associated factors pushed healthcare costs related to the crisis above $215 billion during the study period. Check out the story, guys. If you don't know much about opioids, type in Google and you've come up with this. Go to Wikipedia, it will give you the definition of opioids. So thanks for watching and have a good day and goodbye.